button. Thank you all so much for joining the 2002 Request for Proposals webinar for a special projects grant called iFORWARD, Equipping Organizations in the South Through Technology to End the HIV Epidemic. I am joined by amazing colleagues who will get an opportunity to introduce themselves later on in this webinar. The purpose of today's webinar is for you to ask questions around this particular special project. And we have the Q&A box open. There will also be an opportunity towards the end where we'll get an opportunity to answer all of those questions. The reason why we would like for you to document your question in the chat box is because we would like to create a frequently asked question fact sheet after this based on the questions asked in today's webinar. And so please put your questions in the chat box and let's begin. Today's webinar is being recorded. Again, you will be able to ask your questions in our chat box so that we can properly record those questions. And after that, we will create a frequently asked question sheet. I would like to introduce myself and then allow my two colleagues introduce themselves in a way that is most comfortable to them. My name is Marvell Terry II. I am the Senior Program Manager for the Southern HIV Impact Fund as well as iFORWARD. And I will be your moderator today.
Hi, good afternoon, everyone. My name is Bianca Carrillo. I am a program manager with the Southern HIV Impact Fund, which is the initiative that's working closely with iFORWARD. So great to see you all, great to see where you all are coming from. And I'm excited to share more about this project.
Good afternoon, everybody. My name is Shannon Weiss. I'm the Senior Grants Manager at AIDS United. My pronouns are they, them, and theirs, and I am hailing from the San Juan Islands in Washington State, where it is like 44 degrees and cloudy and should start raining anytime, which is what it does this time of year. So in any case, I'm going to be working on the technology side, well, the application technology side of this. There's lots of technology sides of iFORWARD. So I'll be talking a little about that later. And it's good to see folks. There are some of you on this call whom I know. So hi, especially to you, and great to meet everybody else. And Marvell, I'm sending it back to you.
Thank you so much, Shannon. Again, for those who have just joined us, please introduce yourself in the chat box. Please let us know your name, where you're joining us from, and the name of your organization, and any other information you would like to share in a very respectful way. And if you have questions already, please put them in the Q&A box so that we might, one, officially record those questions, and two, create a fact sheet after this webinar. As we begin, I wanted to provide some information about what is AIDS United. Some of you are very new to AIDS United as an organization. And so the history of AIDS United grant-making portfolio dates back to the founding of the National AIDS Fund in 1988. For more than a decade, we have supported community-driven responses to the HIV epidemic around the country that reached the nation's most disproportionately affected populations, including gay and bisexual men, communities of color, women, people living in the deep South, and people living with HIV and AIDS. The mission of AIDS United is to end the HIV epidemic in the United States. Our vision is that we envision a time when all people, governments, and organizations commit to ending the epidemic and strengthening the health, well-being, and human rights of everyone impacted by HIV. And finally, our North Star is that the voices of people living with and vulnerable to HIV always guide our work. Now I want to tell you about iFORWARD, this new exciting, I'm for sure am excited about this new opportunity. iFORWARD, equipping organizations through technology to end the HIV epidemic, is a special project of the Southern HIV Impact Fund supported by Janssen Pharmaceuticals. And Shannon, I see your hand is raised.
That was accidental. Let me try to find a way to put it down. Sorry about
Okay,
that.
okay, awesome. Okay, the goals of iFORWARD, there's 6 goals of iFORWARD. 1 is to improve access to information. 2 is to enhance organizations' ability to communicate. 3 is maintaining a sense of social and emotional support. 4, establishing and maintaining a virtual community. 5, extending organizations' geographic reach. And 6, it is stigma reduction. I wanted to just let everyone know the reason why I am reading the slides is understanding that everyone might not see the slide. Some people are calling in on their devices. And so I want to be able to, for people that are calling on their devices to be able to see. And so don't want to sound redundant, but just wanted to address all methods of communication that we've allowed people to join. Why are we focusing on technology and infrastructure? Why are we focusing on technology and infrastructure for this particular special project? One is because of COVID. We recognize that we are still literally in COVID, and COVID really amplified our use around technology and infrastructure. If you're like me, you've walked down your local community or your local neighborhood, and you've recognized that there were some minority-led Black and brown small businesses that could not stay open, they could not pivot. And part of the reason why many of our minority-led and small and brown and Black and brown organizations could not pivot was because they did not have the resources in technology and infrastructure. And so similar to those small businesses in our communities, in our towns, HIV service organizations experience nothing different than that. Many of our HIV organizations had to stop services at the height of the pandemic because we did not have what we needed to have in order to pivot and to do other things because of this pandemic. Not only because of COVID, natural disasters. We recognize that Southern organizations often annually have to shut down because of natural disasters. And when we shut down or when we take those couple of days to try to figure out a plan, we recognize that we're losing traction in our goal of ending the HIV epidemic. And so we're talking about access to pharmacies, we're talking about appointments, we're talking about support groups. We begin to lose traction without using technology and without addressing our infrastructure at our organizations. This grant opportunity allows us to expand our reach. It allows us to expand the access in our communities and in our rural areas. And then it also levels the opportunity. As a person that has health insurance, I should not be the only person that takes the opportunity to get online with my provider or to take a therapy appointment on my phone. All communities, all populations should at least have the access to be able to schedule an appointment and do a telehealth appointment. All communities should have the access to meet with their providers or to reach the nurse or to do support groups online. And to be able to do that, we have to acknowledge first that we must improve the way that we use technology and improve our infrastructure and also improve our relationships with technology in our organizations. One thing I would like to highlight that is found on page 3 of the RFP is the eligibility. This is just a snapshot of the eligibility. There's more than this that is on this particular slide, but I wanted to amplify some things that might be different if you have a relationship currently with AIDS United or the Southern HIV Impact Fund. One thing about this particular initiative, because we wanted to make sure that we reached all Southern states, not just the states in the Deep South, but all Southern states as identified by the Center for Disease Control and Prevention, you will see additional states up here that we've not historically worked with. Those additional states will be Arkansas, Delaware, the District of Columbia, Kentucky, and West Virginia. Those are the new states that we've added and the geographic location. And so I hope, I know that there are different locations on this call, and so I'm excited to see some of those particular organizations on this call. The operating budget must be no more than $1 million to apply. Your operating budget must be no more than $1 million to apply. The grant period will be March the 21st, 2022 to November the 31st, 2022. The reporting status, you must be in good standing across all funding portfolios at AIDS United. If you have a question about that, please email us at iFORWARD@AIDSUnited.org. If you have any question about your reporting status, it is my desire that everyone is in good reporting status, but if you have any question about that, please email us. And then finally, HIPAA and protection of information. You will find when you get to your attachments that there will be a place where you can upload how will you protect client information or the community in which you will work with. And so HIPAA and protection of information, we must know what plan do you have to protect the information of the people that you will be engaging with through technology. Before we get started, just wanted to point out a couple of things to you. You can find more information about this grant opportunity by going to aidsunited.org/grants. There you will find the request for proposals. You will find the project budget template, the implementation plan, and the link to our online portal. Later, Shannon will provide guidance on how to navigate that, but there will also on our website be a page-by-page graphics will be included on how to navigate the online portal. And before Shannon comes, I want to just briefly give an overview of the required documents that you will need for submission. And just to let you know that all of the documents must be uploaded to the AIDS United Grantee Community Portal by the deadline of February the 17th, 5:00 p.m. Eastern Standard Time. We will not accept any documents through our emails. Again, we will not accept any documents through our email. All documents must be uploaded through the AIDS United Grantee Portal. And now I will hand it off to Shannon.
Thanks so much, Marvell. Good afternoon again, everyone. I'm going to talk through some of the technology side of applying for this grant. So on your screen, you'll see the URL where you need to go. Please only use Chrome, Firefox, or Safari when you're applying. Internet Explorer and Microsoft Edge don't necessarily play well in the sandbox with online programs, and ours is one of them. So do make sure that you're not using either of those browsers when you go to sign in. I'm going to share my screen. Oh, I'm saying, Marvell, I can't share while you're sharing. Can you unshare and then I can share? Thank you. All right, let's try again. Here we go. Here we go. Here we go. All right, so when you go to that URL that I just put on the screen, and that URL is in that guidance that Marvell mentioned a couple minutes ago, you will end up on this screen. This is where you'll log in. You'll enter your email address and your password. If you don't have an account, you're going to click not a member, sign in here. It's going to walk you through a 2-page sign up process. We'll ask you for your name, your email address. You'll create a password. We'll also ask you for your organizational information. On that page, you make sure you enter your correct organization EIN. That makes sure that if your organization is already in our database, you get linked up with it. And if your organization is not already in our database in the backend, it will create a record for it using the EIN that you enter in. And also, before I move on from the screen, I just want to point out this handy dandy forgot your password link right here. If you do forget the password, just go here. You do not need to write me to have me reset your password. You can do this much more quickly if you go ahead and click that forget your password link. But when you log in, you are going to land on this home screen. So this is similar to what you'll see. I'm logging in as myself. I'm a system administrator, so you will not see this My TA Projects and Payment Center tabs, but you will see everything else here. So when you log in, you'll see if you have some active applications. they'll be here. If you have some stuff that's been submitted, it will show up down here. What you will not have is multiple versions of application. This is my test account, which is why there's lots and lots of things here. So when you log in, the first place you're going to go is funding opportunities. And as Bianca has said in the chat, there will be a recording of this webinar available, as well as those detailed notes that are available on the RFP webpage. So you do not need to take notes on this. You can just watch what I'm doing. You're going to click on iFORWARD 2022, and it's going to bring up this page that shows you some basic information on the grant cycle, which is available in the RFP. The summary text is in the RFP as well. There's reminders down here about the deadline, and there's information here on who to write if you need support. You should write the iFORWARD team at that email address if you need substantive help about your application or the initiative, and then drop me a line at this email address if you want help on navigating our online portal or with questions about submitting your proposal. So what you're going to want to know, and you can see here all the attachments, and these attachments are listed in the RFP itself, and there's another place you can also access them in the application form that I'll show you. So you're going to want to click apply now because you want to apply. And this box is going to ask you, are you sure you want to apply? And of course, yes, you are, because you just said you wanted to apply, but you need to click yes and hit next, because this is the way that this system sends a message back to our backend system, and it creates a proposal for you and pulls it back into your account. So you'll see this box here confirms that you started an application, and it asks you to go to your My Applications page and find this application to complete it. So you're going to want to make a mental note, or maybe a physical note, or note on a notepad on your computer about this number 6426. I'm going to click finish, and you are going to go to the My Applications tab of your screen, which is just what the form showed you. Now, you will likely see everything on this screen. I won't, because again, I have a bunch of test applications, but also if you applied for many AIDS United amount grants before, you're going to click this View All page, which is going to take you to where all of your proposals are. And again, you will not see multiple versions of every application. But we see right here, 6426, which is the application I just started. You're going to want to click on this application name, and whichever application you started will be at the bottom of your list. So you're going to click 6426, and this is going to take you to our application interface. So what you'll want to do is take a quick look at these basic tabs of the application. In this basic information and organizational profile, we do ask that you verify that all of your information here is correct. If anything here is not correct, you're going to see these pencil icons. You're going to click a pencil icon, and it's going to open up the form for you to edit. So you're going to make whatever changes you need to make. And then down here where I have a navigation bar in the way from Zoom, there we go, I've moved that out of the way. You're going to click save to save your changes. I'm going to click cancel because I didn't make any changes, but please do check this the first thing you do. You are not going to need to do anything. In the second tab, you'll see there's a notation that there's nothing available here. Similarly, you can skip tab 3, which is the portion that also you don't need. So you're going to want to look at tab 4, as well as tab 5 and tab 6 that are under more. We'll get to those in a few minutes. So when you go here, you'll see that the proposal form will load. It takes a couple seconds. You may or may not see an email address field here. If you do see an email address field, it will probably have your email already in it, but if not, make sure your email is in, and then hit next. And if you come and you don't see an email address field, just click next. And I have to admit, this is a kink in our system that I haven't figured out yet, but there we go. So that's why there's not always an email address here. So you're going to click next, and you'll land on the first substantive page of the application. So you'll see here that this is where the questions start. You're going to navigate through the form, and if there are blank spaces like this, it's response dependent. So for this on, if you're Compass funded, if you click yes, you'll get some questions that will pop up here. So you're going to navigate through your form, filling out all of your responses. You can click Save My Progress. We actually encourage you to do that after the first page or two of your application. And by first page, I mean this page, the first page where you have substantive questions to answer, just to make sure that your record gets saved. Once you do submit, you'll see a screen that we're going to see later in the submission process, and then you'll refresh your screen and all of your responses will come back in. You can save your proposal as many times as you want. You can log back out and log back in, as long as it's not after the deadline. If it's after the deadline, this form will shut down and you will not be able to access it anymore if you have not submitted your proposal. So instead of having you watch me navigate through this form, as much fun as that might be, we're going to keep things short, and I'm jumping to another application form that I have already filled in. Oh, where is that? Oh, that's right. This did not load because I had computer issues before I logged in, which probably means you might have to watch me do this. Let's see if I go here. I was getting all set. I had a proposal all filled out and ready to go. And then my computer crashed, and I think I had not hit save and finish later. And because my computer crashed, I think it didn't save anything. So if that's the case, I will do a quick fill of stuff. Yeah, it didn't save anything. My apologies. We are going to run this as quickly as possible. So my apologies. You have to watch me do this. I do want to show you the submission process, which is why you're now watching me do this thing that I had tried to plan to do before. For this, so you're going to go in. You can also, you have to answer every question that is on a screen in order to save it. So you can do what I did if you don't have your actual responses that you know you need. Oh, I skipped one. Question 2. So you will get an error if you skip a form. You can enter in anything in a field just to get the form to save. But do make sure if you do that, you make sure you fill those in with actual information before you submit to us. And you'll see all of the required questions have an asterisk in the front of them. That's pretty standard these days. And as you saw on the previous screen, it won't let you submit without, but this does give me an opportunity to show you sort of a live version of what happens. So these forms here, oh dear me, where did that go? There we go. This is what happens if you type gobbledygook. These fields here are where you can enter in any kind of formatted text you like. Tons of fun, you know, bullets and underlined and italics are great to make things more readable. But what these fields do is they convert they convert any formatting to HTML. So I'm just going to show you what this is. And all of these fields have character limits. And if you have more than the allotted number of characters, which are in the RFP that themselves, it will generate an error, but it will not let you know that there's an error. It will let me know on the back end. So in this, in the guidance that is available for you all to use, we're recommending that people use a tool called Word to HTML. And this will help you figure out how many characters you're actually using. So I'm going to paste in what I just put in our form over there. And what you want to do is you want to paste in what you put in here. If you're working in Microsoft Word outside of the form, and we do strongly encourage everyone to do that. That is a best practice, because if you are writing your responses in this online form and what happens to me happens to you and your computer crashes and you haven't saved anything offline, then you lose your answers. And that just makes me want to cry. And I'm not even actually applying for this. So please write all of your answers in Microsoft Word, in Google Docs, in some equivalent, so you have them saved somewhere aside from this form. So do not paste your response from Microsoft Word into Word to HTML, because Microsoft Word puts in a whole bunch of extra formatting that you do not need and that our form strips out. So you want to make sure you copy what you put in our form. You're going to paste it in here, and then this is going to tell you you have 111 characters. So you'll see what it did here is it converted these bullets into HTML. So this adds a whole bunch of different characters to your response. So do go ahead and check these before you submit, just to make sure if there is an error in your application, I will let you know. All right, you will work through it, and I'll send you the URL to this form. Again, it's wordshtml.net, and that also is in the applicant guidance. So going back here, we are going to whip through the rest of this submission process here. So the applying process, so I can show you the submission process, because it's a multi-step process that is not necessarily intuitive to folks. All right, we are getting there. You'll see there are multiple pages to this form, because it's, I think, easier for folks to navigate a form that has fewer questions on a page even if that means there are some more pages. So you're almost there. All right, this is the conclusion page. The order of these questions will follow the order that they are in the RFP. And here we go. Data, and you don't have to answer that one because it's not required. And then these last couple things will reply. All right, so you've filled in all of your responses. You're going to get to this last page of the RFP that's going to ask you if you're ready to review and submit your proposal. So please read all the text here. It has some important information. And you have the option, if you want to confirm that you want to review and submit your narrative, click I confirm, and you're going to click review my narrative. And it's going to take you back through the form just so you can make sure that you've filled in all of your responses, that you don't have anything like this one sitting here, because that is not actually a substantive response that will help our review committee. And you're going to go back through your form to make sure you filled everything in, to make sure that all of your responses are as full and accurate and correct as you can, because you want to give the review committee as much information as they need to make their decisions. Don't assume they know something about your organization that they might not know. All right, here we go. We're going to click next for one last time, and you're going to see that you're back on this page, and your submit button will have miraculously shown up and become active. So you're going to click the submit my narrative button. You're going to get to a page that says, are you sure you wish to submit your iFORWARD narrative? Go ahead and read all of this. And if you are, you're going to click I confirm, and you're going to click submit my narrative. Now you might think you're done, but you're not, because if you read this page, it's going to tell you this last page that comes up here is the last time you have to click submit on your narrative. The reason this page pops up is this is creating the PDF of your narrative that the review committee will see when they look at your proposal. So you can skim through here. You're going to see all of your responses. For me, you're going to see a lot of ones because it's not actual responses, but you will see that. You can click continue to submit your proposal, or close if you decide you want to do something else. So we're going to go ahead and continue and submitting my form. And then when you scroll up, you're going to get a confirmation on your screen that your narrative has been submitted. You will also get an email within a couple seconds letting you know your proposal has been submitted once you finish the last couple tabs. So we're going to go to tab 5. And this is where your attachments are. So you're going to see a whole bunch of stuff here. You're going to want to go to click view all. And here you'll see all of the attachments that are listed in the RFP. You'll have to scroll down a little bit to see the last one. You'll see whether they're required or optional. This attachment status is going to say pending application submission until you submit in the last tab, and then it will change to submitted. To attach an attachment, you're going to want to click on this attachment ID. Oh, and if you want to sort them, you can click this to sort them either in reverse or actual alphabetical order. So we're going to go to project budget to submit this form. I'm not going to have you watch me submit all of these attachments. You're going to see here a reiteration. This is the project budget. That there's a template, and then it's required. And then over here, you're going to see the template link. Now, this is the same project budget form that should be listed on the RFP webpage, and it should also be linked in the RFP itself. So if you already have it, you do not need to download it again here. But if you have not downloaded the form, this is where you can download it onto your computer, fill out and upload it. And then here we go. You have 2 upload prompts. If they're the same, you can upload to any one of those, and it will upload to both places. I'm going to drag and drop. You can also click the upload files button and browse that way to your computer. So once it's done, you're going to click done, and then you're going to hit the back button on your browser. This will take you back to the attachment list, and you'll see that I have 1 project budget attachment ready, and you'll also see the submitted narrative showed up. So this is the attachment from tab 4. Now, once you've done all of that, and I'm not going to have you watch me do that, you're going to go back to your application for the final step, which is here in tab 6, where you're going to submit. And this is just telling you, if you submit here, you cannot edit anything else. The caveat to that is you cannot edit anything else without writing me and asking me to kick your proposal back to you, which I will be happy to do if you have enough time before the deadline to do that. It just is an extra step for you. So if you wish to submit your application, you're going to click yes, and you're going to click next. And you'll see it's going to give me an error because it says, I need to make sure all the required attachments are uploaded. And it's just telling me, hey, make sure you did everything, which I didn't. But when you've done, it will tell you, you will get a confirmation. And I think that's it for right now, and the dogs are barking, so I'm going to go on mute until we have question and answer time later. So Marvell, back to you.
Thank you so much, Shannon, for that information. In my haste, I did not talk more about this particular slide here. I went past it very quickly, but there are some questions in the comment box that I want to address in this moment. There was an error on my part. The grant period is March 21st through November the 30th. March the 21st through November the 30th. 2022, I initially said November the 31st. We know that there is no 31st in November, so it is November the 30th. When it comes to the question around reporting status, that of course pertains to past grantees and current grantees of AIDS United. If you've never been a grantee of AIDS United, that particular section has nothing to do with you. If you do not have a fiscal agent, if you do not have your own 501c3, you can get that relationship with the fiscal agent. You will see here in the forms that need to be submitted, you will need to attach that particular agreement. A question around the operating budget. When we talk about the operating budget being part of the eligibility, you can bring in no more than $1 million. That is your entire annual operating budget. And so that includes everything that is coming in with your organization, that dollar amount at the end of the day. If it exceeds $1 million, then unfortunately you cannot apply for this opportunity. So items you need for submission, definitely the applicant questionnaire, the proposal narrative, the implementation plan, that if you are applying for infrastructure and project specific, you must complete the project budget, infrastructure and project specific support, your current annual operating budget. If you are having a fiscal sponsor, their fiscal sponsor budget will go there. Your board of directors list, your organizational chart. There's an acknowledgement of respectability and digital marketing expectation. That is actually a checked box within the application. You will need to at least acknowledge that box as a form of submission before you submit the entire application. You will need to put your HIPAA protection of information plan there. Your fiscal sponsorship agreement, your memoranda of agreement or letter of support, which is optional, and your theory of change or your logic model. So sorry, I skipped this page. I see that we're getting more questions. Again, if you have a fiscal sponsor, you are applying for this grant in your name, but you are uploading their financial information. You're uploading their financial information to this. Let's talk about the proposal narrative. Again, you can visit aidsunited.force.com to get started. In the proposal narrative, there will be 4 parts. There will be the budget information, the purpose and context, whether you're doing project specific or infrastructure support questions, and the conclusion. This information can be found on pages 10 and 11 of the proposal. Let's talk about the budget information. For your amount requested for this particular grant opportunity, we have predetermined the amounts that you can apply for. So that's either $1, $3, $5, $7, or $10,000. You cannot apply for more than $10,000. Again, there's a predetermined drop-down box of the amount that you can apply for. Therefore, your budget must align up to one of these numbers: 1,000, 3,000, 5,000, 7,000, or 10,000. You cannot do multiple choice. You must pick one. You will upload your organization's total budget for, well, not upload it, but fill in a text field for your organization's total budget for 2021. And also tell us what percentage of your budget would this grant represent. For the narrative part part 2, we will ask you questions around your purpose and the context. This can be found on pages 10 and 11 of the RFP. The purpose of the grant, 1 to 2 sentences. What need have you identified and how will you meet this need? The geographic and priority populations. What does the HIV epidemic and your work as an intersection look like for you in your local town? Your organization's core activities. What is your organization's core activities? Has there been any major changes to your organization? And are you applying for a project-specific grant or an infrastructure support grant? Based on your answer to that the last question, this will come up whether it is project-specific or infrastructure support. Now I'm going into detail about project-specific request. This is found on page 11. You'll be asked questions about the particular project that you are proposing to do. What is your overall strategy? What opportunities do you see within your community? What are your expected challenges to implementing this project and the staff and management for this project? You will also be required to upload the implementation plan as well as your project budget. Categories that fall up under project-specific grants. This can be found on page 7 of the RFP. Digital campaigns that promote linkage to care and or treatment as prevention. Digital campaigns and or hybrid events addressing social and structural determinants of health. The creation of digital health literacy materials and digital and hybrid workshop events with high impact populations. You will need to check one of these boxes around your project-specific grant that you're applying for. If you're going out for the infrastructure grant, the infrastructure support, the questions that will be asked of you is, what is your organization's overall strategy and goals and expected long-term outcomes? What are your benchmarks for success? What opportunities are driving your organization's efforts and resources needed? The challenges to meeting identified goals and benchmarks. And again, a required attachment will be the implementation plan and the project budget for infrastructure support. The infrastructure support categories in which you can apply for will be support for social media or content creation staff, building of your infrastructure for Wi-Fi, the expansion of telehealth services, including live video conferencing, mobile health app, store and forward electronic transmission, remote patient observations and teletherapy, telemedicine, and telepharmacy. Subscriptions to Zoom or other teleconferencing platforms. And finally, the purchase of infrastructure building tools such as hotspots. The part 4 is your narrative, which is the conclusion. The narrative part 4, which is the conclusion. This can be found on pages 11 and 12 of the RFP. We will ask you questions around your sustainability, around partnerships, around your current evaluation capacity, and any additional comments that you would like the reviewers to read about your particular organization. Again, letter of support and the logic model or theory of change is an optional attachment that you can upload. There was a question in the chat box around, will this grant opportunity be an ongoing opportunity? Currently, this is a one-time special project funding opportunity. We do ask you a question in the conclusion section about your sustainability. What if this opportunity does not present itself again? How will you sustain this opportunity within your community? Tips for a successful submission. Please perfect your proposal narrative in a Word document first. Remember, there are word count limits, and so please be mindful of that when you're looking at the RFP. We will this afternoon also upload a Word version of the RFP, so that can be easier for you to navigate. Follow the navigation guide closely to best navigate the portal that is also found on the AIDS United website under iFORWARD, under grants, and then go to iFORWARD. Make sure you are using AIDS United templates when requested. We will not take a template with the budget or the implementation plan that is not AIDS United. And so you will also find that within the RFP. You must use the template that we've created and provided for you for the budget and the implementation plan. Finally, please email us and give us a 1 business day, acknowledging if you email us on the weekend that 1 business day does not technically start until Monday. And so you might get a response Tuesday morning, similar to banking. If you have any portal questions, please email Shannon. If you have any RFP and any other questions outside of that, please email us at iForward@aidsunited.org. One final thing I would love to point out is that if you are funded under this initiative, there will be professional development and technical assistance provided. A representative from each awarded organization will take advantage of 5 module courses, live module courses that will be 90 minutes each, that you will have pre-course work, the 90-minute live online training, and homework after that, where we will discuss together as a cohort. And then the second piece of technical assistance that you will be able to get is each organization will be provided a tech coach. There are 3 tech coaches. 1 tech coach has an expertise and experience around digital campaigns and digital health literacy. The second tech coach will have experience around telehealth and telemedicine and telepharmacy. And then your third coach has expertise and experience around infrastructure, marketing, and communications. Finally, we do have an opportunity for alternative application process. To be considered for that process, you must email us by February the 9th, 2022. You will find more information about this on page 14, but there are some requirements that you must meet as well about this to meet this particular requirement as well. And you can find more information about that on page 14. But the deadline to email us is February the 9th, 2022. Here are the dates that matter. Here are the dates that matter. I want to jump to the highlighted portions. Again, there's an error there. The grant period begins March the 21st and it ends November the 30th. November the 30th and not 31st. Your interim report is July the 31st, 2022. The grantee convening will be April the 26th and the 28th. So it'd be 2 days, April the 26th and April the 28th. And your final grant report will be due January the 15th, 2023. The scoring rubric that the external grant review committee will use will be as following. The applicant questionnaire will be worth 40 points. The proposal narrative will be worth 50 points, and the attachments will be worth 10 points. Now I would like to pause and address any question and answers that we might have that I've not gotten a chance to answer. Okay, one question is, you said this is for ending the epidemic. How does serving or support groups relate to ending the epidemic? So thank you so much for that question. We are working, as many HIV and AIDS organizations are doing, to align our projects and our work to ending the HIV epidemic plan, as well as other national strategies, the ending the epidemic plan and the national HIV and AIDS strategy 2.0. We ask these questions in your grant application to force you to align your projects with one of those goals. Is it is it diagnose? Is it treatment? And then there's some more goals as related. Again, we're just asking that as you write your proposal and you read the End the Epidemic plan as well as the National HIV and AIDS strategy, what does your project align with according to those strategies? Another question, if you are a small grassroots or community-based organization with a very small budget, could that potentially have a negative impact on eligibility for this grant application? No, you are who we're looking for. And so that is why we made a limit in the annual operating budget of $1 million. It is our goal through this opportunity that we are reaching small minority-led organizations, and you are the organizations that we're looking for. And so you having a very small budget does not hurt you or impact you negatively to apply. Can funding be used to develop a new app which will increase access to retention in healthcare and support services for people living with HIV? So while I have implemented categories in which you will need to check, what you do particularly from those categories is what you want to do. This funding opportunity is meant to incite innovation. And so for you as an organization around technology and infrastructure, if creating an app that will increase access to retention in healthcare and support services for people living with HIV, if that is innovative to you and that is what you want to apply, feel free to apply for that. What I will come back behind that to say is you will have to upload how you will protect information, your client information on this app. That is a requirement. How will you protect client information if you are creating this app? Does telehealth honor complementary alternative medicine and other integrative health practices? We will need to be more detailed with this response. I am aware that there are many alternative medicine practices. And so I ask that you give us more time to think on this because this question, there are many alternative forms of medication, including cannabis. And so I want to be able to respond to you in a responsible way that accounts for this. And so while I do not have an answer for this in this moment, please give me an opportunity for the answer to reflect on the FAQ that will be created and uploaded today. Again, the question around complementary alternative medicine and other integrative health practices, I want to be more detailed in my response to that question. And so please look out for the frequently asked questions. For the person that asked that, if you would like to engage me more on what you mean by that, please feel free to email us at iFORWARD@AIDSunited.org. I would love to schedule a quick meeting with you to talk through what you're particularly asking. Can fiscal sponsors apply for themselves? Yes, fiscal sponsors can apply for themselves. And so if organization A, is using organization B as my fiscal sponsor, when I go to the initial application process, I still will put organization A's name in the information. You are only uploading your fiscal sponsor when it comes to the budget and the fiscal agreement. And so the application itself will be in your organization's name that seeks to write the application. I will stop sharing my screen because I recognize that there are some hands raised and I would like to get to those hands. And so first up is Michael Ward. I will allow you to talk.
Hey, that was totally an accident. I am so sorry about that, but I appreciate your attendance.
All right, thank you so much, Michael. Next we have, let's see. Next we have WISMY. You have the opportunity to talk. Wimsme Sias, if I'm pronouncing that correct. If not, I apologize. Would you like?
Hi, good afternoon,
Yes.
everyone. I made a mistake by clicking on this. I will take the opportunity to ask a question anyway that I was tapping on the Q&A box. So you mentioned complementary medicine earlier, and I was thinking about meditation, massage therapy, and other stress-relief therapy that could be used as form of complementary medicine, which contribute to the quality of life of a person living with HIV. Most of the time, I don't hear about those in the system of care for people living with HIV. I was wondering if those could be some of those medicinal practices that could be funded through this platform.
Sure. I had trouble hearing the entire statement, but I think I've pulled from it what I think I hear. You mentioned massage therapy. You mentioned that there are additional ways outside of medication that might support living people with HIV. And what my response would be, we will welcome those applications. My suggestion is that you will need to be very detailed on how you will meet goals with providing massage therapy through technology and through visual. We will need to really see that explained, but yeah, sure, you're able to apply and write that in your grant. If you have further questions around that, please email me at iFORWARD@AIDSunited.org. Okay, the next person is Jack Carrell, Carrel. Jack, you have your hand up.
Sorry,
No problem.
there's a boo-boo.
That was an accident?
Yeah, I set my
Okay.
phone down.
Okay, thank you so much, Jack.
Sorry.
All right, let me just make sure I'm not seeing any more additional questions. My final comment would be this. This is a funding opportunity that you can dream big. Again, I did not go into detail. We left the categories very broad. And so when you think about a digital campaign to address the social and structural determinants of health, we could talk about racism. We can talk about homophobia. We can talk about transphobia. We can talk about all of those barriers that certain populations encounter. What does a digital campaign about that looks like? What does a digital publication around health literacy? We're talking about why don't people take their medication, or what ways could we further promote new ways of medication for people living with HIV? So we're very broad in our categories because we want you, the organization, to be able to dream big. What does it look like to do a talk show? To address some of these issues in our communities. We will be able, with the adequate application, we will look to fund that. We will look to fund a podcast, because what that does is that grows community. We would love for an application to reflect that. And so I don't want people to be so traditional in their approach to what health and wellness look like and what health and wellness looks like in grants. This particular opportunity, when we talk about technology, we have to look at various ways that technology not only levels our playing field in public health, but it also gives us the opportunity to look at health innovation in a very different way, and also close the digital divide in our communities. And when we speak about the digital divide, we really speak about the have and the have-nots, those who have broadband and fiber and Wi-Fi versus those that do not have those opportunities in their community. One way when we talk about one of the goals is stigma reduction. Well, if I am going to the clinic or the health department as a Black gay man and I see that at the front desk is my church member, I'm not likely to return back to that clinic or that health department. But if I can meet my provider on my phone, then it is reducing the stigma and it is more likely that I'm staying into care. And so I want us to think very differently about how we are approaching healthcare, how we're approaching how we're looking at ending the HIV epidemic. We have 2 more minutes. I want to make sure that I've answered all the questions. I want to check in with Shannon and Bianca to see if you've seen or identify any questions or want to elaborate on anything else.
I'm good. Thanks for checking in with me, Marvel.
Thank you so much, Shannon. Bianca?
Nothing in particular, but I do want to make note that the RFP does not necessarily have the correct grant period dates on there. So I just want to reiterate, Marvel said it earlier, but the grant period does begin March 21st, 2022 and ends on November 30th, 2022. And we're going to work to make those updates reflected on the AIDS United website where the RFP is housed, and to make sure you all have the most accurate information as you're applying.
Thank you so much for that, Bianca. Again, please reach out, iForward@aidsunited.org. If you want to have a quick conversation, we're making ourselves available for that. Again, the deadline is next Thursday, February the 17th, 5 p.m. Eastern Standard Time. Again, 5 p.m. Eastern Standard Time, as Shannon gave instructions earlier. Anything after that, the system will not accept. And we will not accept any applications through email, unfortunately. Thank you all so much for attending this webinar for iForward. If you have any questions, please reach out. Good luck to you.